so that I can talk you through a PowerPoint presentation. Don't we all love the PowerPoint presentations? Hopefully we'll get the screen up.
I can see it, Melanie. Perfect.
You can see it? Can it? Good. Alrighty. So you can all see that. Well, thank you very much, everybody. Like I said, my name's Melanie. I'm the head of the nursing and midwifery in the School of HEMS, which is Health, Education, Medicine and Social Care. So as Rosie said, that because health is so big, I'm focusing on nursing and midwifery, but there will, I suspect, be other sessions in relation to allied health professionals such as paramedics, operating department practitioners, education, of course, teaching years, and of course social work. They're all looked after by a different head of schools, so I'm sure they'll be delighted to come and talk to you about their remit. Is there a need for more nurses and midwives? We look at the current pandemic, the shortage is out there. Nationally, there are around 43,000 registered nurse vacancies, 28,000 midwifery vacancies. But that's not the main thing. The main thing is that about half of those are going to meet retirement age within the next 10 years. So there's going to be even more vacancies. Now, I had a quick look on Southend Hospital's website yesterday, and I spoke to the chief nurse there. And they've currently got 73 different registered nursing vacancies on their website, just in their main hospital in Prittlewell Road in Southend. When I spoke to the chief nurse, she said, Melanie, she said, don't forget to add in all those numbers, the shortages of community nurses and midwives, practice nurses, the private hospitals, the prisons. And in essence, in the east of England has got approximately 6,200 registered nurse vacancies and nigh on 3,000 registered midwife vacancies. And these stats were taken in March, end of February, beginning of March. So that's before the COVID pandemic. I suspect we might have a little bit of a shortage at the minute with people self-isolating and stuff like, but generally that's an awful lot of vacancies. Now our government, current government that is, who knows what happens when the next government comes in, but they've pledged a commitment to train 50,000 new nurses over the next 10 years. But why are there so many vacancies? Because who wouldn't want to be a nurse or a midwife? You know, it's been a fantastic career for me. But could it be because of the public perception? Nurses are little angels, aren't they? You know, here we are with our cartoon angel. It's a lovely little job. Lots of people think of Florence Nightingale and her Crimean activities, pushing the boundaries of nursing forward. And those of you who might be of the similar age to me may also have a perception of Hattie Jakes, you know, in all those Ealing comedy Broadways that talk about the nurses, you know, being a little bit ditzy and a little bit almost like a doctor's handmaiden and don't actually do anything. That is so not the reality of it all. The reality is that nurses are highly educated. They have such diverse roles and they work in so many diverse settings. And a very large piece of research carried out in 2014 identified that degree education line. So every 10% increase in nurses with a degree associated with a 7% reduction in death rates. So for those of you that can remember way back, nursing was not actually a degree profession. It wasn't even a diploma profession. You just went and you trained at the local hospital to be a nurse. That all changed when the Nursing and Midwifery Council were formed. Actually, before it was the Nursing and Midwifery Council, it was the UKCC. But the Nursing and Midwifery Council are a UK regulatory body Their responsibilities for nurse training are set in law. We have to follow exactly what is written in the standards because that's now enshrined. The Nursing and Midwifery Council, they regulate nursing, midwifery, and also some specialist nursing roles like health visitors and school nursing. Just to point out that health visiting and school nursing are what we call post-qualifying nurses. So you have to do your basic nurse or registration first, and then you go on post-qualifying to become a health visitor. Of course, the downside to being a nurse and being on the Nursing and Midwifery Council register is that they do charge us all an annual fee. That goes towards their upkeep, you know, so that they can regulate and employ the correct people to make sure that every nurse and midwife out there is doing the right thing. It's at the moment it's £110 a year. You pay it once a year, but you can pay it in instalments. But you don't pay it whilst you're studying. It's only once you become qualified and you want to go on the Nursing Council register. Now, this Nursing and Midwifery Council, they approve higher education institutions such as ours to deliver nursing and midwifery courses, and they monitor the quality as well. So every single university that runs and delivers nursing midwifery qualification has had to be approved by the Nursing and Midwifery Council, and then every year we have to do self-assessment reports, and every 3 years they come and pay us a little visit, a bit like Ofsted, you know. Sorts of nursing. So first of all, I'm going to talk about what people think of as a general nurse. So it's now a bachelor's degree level. That's the minimum requirement you can have to be a nurse. And ours is a BSc honours in nursing, and we do that in 3 separate fields. We call them fields. So we do it in adult, child, and mental health. We also do a dual registration award, which is adult and mental health, or child and mental health. They're 4 years long, those courses. The other degrees are 3 years long. Now, at the end of your 3-year course, if you've done it with us at ARU, you will have met, or the learner will have met, all the requirements to be registered as a nurse, and we automatically upload them to the Nursing and Midwifery Council onto a certain part of the register. So I myself, I'm on the adult part, some of my colleagues are on the child part, and some are on the mental health part. This dual registration award, it's 4 years long. When we register you with the NMC at the end of it, we'll register you on both parts. And the reason we introduced this is because mental health at the moment, everywhere, even before COVID, you know, people were starting to really talk about mental health, and you don't have to separate mental health from anything. It comes part and parcel of who we are. So to have somebody who's trained in adult nursing and mental health nursing, spot on perfect. Same with children and mental health. So those are very much in demand. All nurses are in demand. But the child and mental health and the adult and mental health are new. We only started running them very recently, and we haven't had any graduates from it yet. But they should be, you know, one of the things that give perhaps people a little bit of an edge when they're employers are looking for jobs, you know, for people to come and fill their jobs. Having said that, however, there's absolutely no reason for any person who leaves ARU with a nursing degree not to get the job for which they have trained. I've got some employability statistics which I'll give to you later on. So BSc Hons nursing. A registered nurse, you might have heard people call them. Many moons ago, it would be a state registered nurse or a registered general nurse. Now it's registered nurse. They are all autonomous practitioners. You know, they will quite often, you will quite often see nurses and not doctors. There are so many nurse-led clinics. You can go to your GP and see a nurse. You can see nurses in the community who will plan and evaluate your care and lead and manage teams. All of the things that generally in historical times used to perhaps be the remit of a junior doctor. Nurses now are able to provide all of these things, and you would never see a doctor. Obviously, there's entry requirements to think about. So generally for the BSc Hons in nursing, all different fields and the dual registration, we're looking for between 96 and 128 UCAS points. Usually we ask for 5 GCSEs or equivalent, with at least English and maths and a science at grade 4 or above. Now these are our general standard entry requirements. If you have a learner with different qualifications, non-traditional qualifications, we can look at that and take equivalencies. But one thing that every single applicant to a nursing course has to have, because the NMC says so, is an interview. When we interview, we're not looking for people to know how to be a nurse or a midwife. We're looking for people that got the values to be a nurse or a midwife. So the interview is 20 minutes long. It's scenario based. We give people a little scenario. Mr. Smith is 82 years old. You know, he's walking around the hospital ward naked. What should you do? You know, and it's just things about privacy, dignity, respect, and so on and so forth. Please bear with me 1 second. So, but also when an applicant applies, we do send them information on preparation for the interview, gives them all the information they need. And if they have any questions, they can at least always call up our admissions team who will talk them through it. So, quick recap on that one. It's a degree level course. It can either be 3 or 4 years long, 4 years if you're doing that dual registration. It's made up of 50% theory and 50% clinical practice. So they'll be in university doing all their theory work, and when they're doing their clinical practice, they will be in acute hospital settings, community hospital settings, surgery, medicine, care of the elderly, A&E, GP practices, all those different areas. We rotate them through so that they can get the experience they need in order to achieve the competencies that the NMC say they must have in order to be admitted to the register at the end of their course. The one thing that I must point out here is that it's 45 weeks per year. Now, some people go to university and study history. They start in October, they finish in May, and each year, and they have study weeks and reading weeks and loads of time in between. A registered nurse and a registered midwife course is full on 45 weeks a year. They don't have all the summer off like all other university students, and they have to still carry on going to their clinical practice. And when they go to clinical practice, they have to be prepared to do nights, weekends, early shifts, late shifts, because that has to prepare them in readiness for their role as a entry-level registered nurse. When they do qualify and they get to that entry level, it doesn't matter where in the country they work, apart from London, which has the London waiting, of course. The NHS has what's called Agenda for Change. Everybody, whether you're in Bangor or Bournemouth or Brighton, get the same pay regardless, you know, depending on the band that you're in. So a newly qualified registered nurse starts at the bottom of a band 5, that it's called, and that's just short of £25,000 a year. Now, a lot of people say the reason we haven't got a lot of nurses is because the pay is not very good. £25,000 a year for a 22-year-old, not bad, I don't think. Don't forget, on top of that, they'll probably get shift enhancements, etc. Good pension, got to think about that as well. Even when you are only 21, 22, you've got to start thinking about that. But what we need to try and do with our learners is get them to think beyond that entry level role. Within nursing and midwifery, the rapid progression, usually up to a band 6 within 12 to 18 months. Look at the salary there, £31,000. And then band 7s, which would be a ward sister role, ward manager role, Melanie, come on, ward manager role, things like that. Band 8, and then obviously right up to chief nurse, etc. Bands 9, you know, you're looking up to £80,000 a year. Let's be real here though, those roles are fewer. Obviously everybody needs your band 5 and your band 6s and quite a few band 7s, but the higher up you go, obviously the less roles there are. And these roles go into advanced practice, management, leadership, research, and of course, like me, into education. The sorts of things that they can do. So if you were an adult nurse, you know, you could work in any one of these areas, you know, cruise ships. Do you know what? I often fancied that myself when I was younger. Fancy just being a nurse on a cruise ship, looking after people, you know, and seeing all those lovely places. Why not? You know, hospices, prisons, nursing homes, community, you know, all these places. Same as children's nursing. I'm not going to read them out because you can read them there. And the same with mental health nursing. And of course, one thing I haven't mentioned is that there is a further field of nursing called learning disabilities nursing. It's not something we offer here at ARU, primarily because the demand for it is not great anymore. But there are 1 or 2 universities out there that do still offer that fourth field of learning disabilities nursing. So that's generally the BSc Hons nursing, 3 fields and the dual registration. However, there was a gap in the nursing market for a different role. So the NMC introduced the nursing associate. This is a foundation degree that is designed to bridge the gap between a healthcare assistant and a registered nurse. The absolute beauty of this is that once you've finished qualifying as a nursing associate, you can top up to a registered nurse. The other beauty of the nursing associate is that it's a generic qualification. Remember I said to you that if you're a nurse, registered nurse, you're either an adult registered nurse, child, mental health, or learning disabilities. The nursing associate's a generic field role, so you can work in any area. And that was introduced by the NMC in 2019. And ARU was one of the first institutions to actually put nursing associates on the nursing associate part of the register. Absolutely fantastic. And the differences are that a nursing associate undertakes work within 6 platforms and the registered nurse within 7. Whereas a nursing associate and a registered nurse both have to be accountable, they both have to prevent health and prevent ill health. There come slight differences further down. So a nursing associate will provide and monitor care, whereas the registered nurse evaluates it. And for example, both of them have to improve safety and quality of care, whereas a nursing associate contributes to integrated care, whereas a registered nurse coordinates it. So there are slight differences, and as such, the nursing associate role is generally at an agenda for change band 4, so that's 1 below a registered nurse. However, the entry requirements are not as steep as for a registered nurse. We like students to have an A level or a level 3 qualification, but it's only preferred, it's not essential. what they have to have is the GCSE Maths and English at grade 4 or equivalent, functional skills, etc. Again, they have to have an interview. That's an NMC requirement. So this route has proved very, very popular for those that didn't want to go on to take A-levels, or they attempted their first year of their A-levels and it wasn't for them. So we've got an awful lot of nursing associates that have done that, thought, no, this is not for me. I'd rather be doing something practical and learning towards a career now. So they come and do their nursing associate foundation degree with us, which is 2 years long. So like I said, it's a foundation degree. It's 2 years long. It's exactly the same, 50% theory, 50% practice, exactly the same, all those different areas that they will go and get their competencies achieved, and it's the same length of year. At the end of that, they would be put on the register if they're successful as a nursing associate, and they would start work bridging that gap between healthcare support workers and registered nurses. And then they might think to themselves, do you know what, I can do this, you know, and they can take their nursing associate qualification and top it up to be a registered nurse. The good thing is they can probably do that whilst they're working through an apprenticeship, which I'll talk to you about in a minute. So just like the registered nurse, careers for the nursing associate, identical, pretty identical. But the good thing about a nursing associate is they can flex between all of these because they're not field specific. So they might want to start off work, you know, in a ward in a general hospital, and then find that they're leaning towards working with people with mental health problems. So they could apply for and get, you know, a post in a mental health area because their role is not field specific. I mentioned to you, didn't I, apprenticeships. So apprenticeships, as you know, the government introduced the apprenticeship levy and lots of apprenticeships sprung up. It's an alternative entry route to nursing, and every apprentice is sponsored by their employer onto courses. Now, some hospital trusts have sponsored their nursing assistants, you know, their healthcare assistants, to come and do the foundation degree as a nursing associate, and some have sponsored others who have the entry criteria to do the BSc Hons nursing as an apprenticeship. The good thing about an apprenticeship is there's no fees for the learner to pay. The fees are by the apprenticeship levy, and on top of that, the apprentice, whilst they're learning, gets paid their salary. Because they get paid their salary, they're not eligible for any financial support from the student maintenance grant. The downside is not every hospital can send every member of staff on an apprenticeship. They'd have no staff left in the hospitals to deliver the care. So they are quite limited rather than the direct entry routes that I've mentioned earlier. What I think your learners should do is look at the local hospital trusts and local employers, because quite often they advertise, they don't just take from their current staff and make them apprentices. Sometimes they advertise for people to come on board with them and do the apprenticeship. So it's always worth suggesting that to your learners. Midwifery, BSc Hons midwifery, different to nursing in that there's no separate fields. So again, midwives provide care to newborn infants and families. They work all the way from pre-pregnancy, through pregnancy, and all the way to the postnatal period. They're more than often the lead professional for childbearing women and newborn infants. You very rarely see a doctor when you're in labour and post-pregnancy, unless there are complications. But even now, there are nurse-led midwifery clinics for that kind of difficult pregnancy. So again, the role of the midwife has developed and has become more autonomous and because it's now degree level, they've got the knowledge and the expertise in order to be able to do that. Entry requirements very similar.
Melanie,
96. Yes.
Really sorry to interrupt your flow there, but I'm just conscious of time. Is there any way we can speed through in 1 more minute and then allow time for a few questions?
Absolutely. Entry requirements pretty much the same. Again, exactly the same for the different times, you know, the places that they go. It's the same thing on qualification, progression, salary, etc. What we at ARU are very proud of, though, is our widening participation. We welcome applications from underrepresented groups, those with learning needs and physical restrictions. Those are not necessarily a barrier. The NMC and ARU will put reasonable adjustments into to support people with both learning and physical needs. So if you have a learner that fits into that category, have a chat with us, and we'll be able to advise you further as to whether it would be appropriate or not, but don't immediately dismiss it. Oops, missed one out. Financial support, unless they're an apprentice, they would apply for a student loan, that covers their fees. They can also apply for a means tested maintenance element. But this is the crucial bit, and I want to say this before we finish. The training grant. From September this year, the government has introduced at least £5,000 a year to every student nurse, midwife. It does not have to be repaid. It's to help with their living costs. Some might get more, but it's a minimum of £5,000. It's a job for life. They're in nurses, midwives, nursing associates, they're in demand. Employability is built in. Last year, 99% of our students were employed in professional roles within 6 months of their course. When you do a nursing degree, it's 2 for the price of 1. You're getting a degree which opens doors. Of course it does, any degree does. You get NMC registered nurse or midwife qualification, which opens more doors as well. It's a win-win. It's a win-win. Things to consider when you're advising. Where does your learner want to live? Where do they want to work? Who do you want to work with? Because that will depend what kind of nurse or midwife you want to be. You know, what suits your values, what will motivate you. I've put on the next slide some websites that can give you some more information on how people can prepare, you know, perhaps doing a bit of volunteering, but that's not necessary. It's not 100% necessary, but it just helps people prepare and understand what the role of the nurse, midwife, nursing associate is. And then there you go. And we've got 1-2 minutes, but I can hang on for a bit. I'm just going to stop sharing. There we go. Any questions from anybody?
That was lovely. Thank you very much, Melanie. That was really, really useful and gave a really great overview of both nursing and midwifery. If you're happy to stay on for a few questions, and we're happy to stay on for a few minutes, so please do ask if you have any questions specific for your learners.
Lindsay.
Hi, I just wondered if you could say a little bit more about nursing associates, please.
So like I said, the nursing associate is a relatively new role. Like I said, 2019, the NMC regulated it. They do a foundation degree. So they do level 4 and level 5. It's a 2-year course instead of a 3-year course. It was designed for those that want to do something other than their A-levels. And want to get out there and get started in the workforce straight away. And maybe those that perhaps you might think to yourselves, actually A-levels are not for you, but our student support services and the help we can give students to achieve a foundation degree. So they would come with the required amount of GCSEs, of course they would. If they've attempted level 3, that's great. If they haven't, it's not essential. And we can then help them level 4, level 5 at the same time as they're working in practice. And at the end, they'll have a fantastic foundation degree. If they want to, they need never go any further. They'll still go on the NMC register as a nursing associate. But what that does mean, Lindsay, is that they will probably always stay at a band 4, an agenda for change band 4, because unless they top up to become the registered nurse, there's nowhere for them to go. You know, so they would stay as a nursing associate unless they do the top up to the degree, get the registered nurse, and then they can go flying sky high. But some people, I just want to stay as a nursing associate and plod along with my life. And it suits some people for now, because don't forget, once they've got that qualification, it's in the bank. Yeah. If they've got family commitments, small kids, you know, a difficult home life, they might want to stay as a nursing associate for 5-6 years and then consider topping up to a nursing degree and going high up the ladder.
Okay, thank you.
Okay, we've got another question and hands up from Nick Shard.
Yeah, right. Just a quick question regarding the apprenticeships, really, after sixth form and college. Would you recommend it's okay to go and do that, or would you recommend, say, maybe doing a bit of work experience, maybe being a HCA or something like that before going on to an apprenticeship afterwards?
There's no requirement for anybody to go and work as an HCA first. You know, for whatever, whether they want to do direct entry or apprenticeship. Obviously, those that do get that experience beforehand probably have a better understanding of what they're letting themselves in for, Nick, because it's, you know, it's quite hard work becoming a nurse or a midwife. Lots of NHS trusts, especially in the Southend area, have sent their current HCAs who are eligible on to courses, and now they've got kind of none left to send. So what they're doing now is they are outwardly recruiting people to come and work at their hospitals, you know, NHS trusts, and putting them straight on to an apprenticeship. So, but those are few and far between. I guess if somebody really wants to see what it's like first, a job as an HCA wouldn't do them any harm. But it's not 100% necessary, especially for the direct entry route. If you want to do an apprentice, there still are 1 or 2 NHS trusts that are saying, well, you know, you need to work for us for 2 years before we're going to second you on an apprenticeship. You know.
Okay. We have another question in the chat box, which is, what age do they offer apprenticeships from? Do you need to be 18?
No, 17 and a half. But if they're under 18, I have to sign a declaration that I will be the person that looks after them until they become 18. So 17 and a half, they have to be.
Fab, thank you. We've got another hands up, Amir Ghanari.
Hi there, Melanie. I've got a question, which is, if we have adults who are working in care homes or as domiciliary care workers, and then they're interested in becoming a nursing associate and the nursing associate qual, do they have to have the GCSE Maths and English at 4 or equivalent, or is there are there, you know, can experience as a care worker, for example, kind of be sufficient?
Amir, I wish it would. This is not a university barrier, it's a Nursing Midwifery Council barrier. But we do take equivalents, and we have our own numeracy equivalency test that we can provide applicants. The English one is a bit more vague. But if you've got an adult learner that wants to do that, you know, speak to us, because there are quite often things that we can take as equivalents, because the NMC, although they say they must have the level 4 or equivalent, they don't dictate to me what I would say. You know, they don't say that's equivalent, Melanie. If I say, well, I think that's equivalent, then obviously if it's very tenuous, they might tell me off. But generally we can take most equivalents, and our own numeracy test, we can ask your adult learners to do. It's not that complicated because it's not like a GCSE. It's a medical calculations rather than maths. And we've got practice tests we can share with you, Amir.
Okay, smashing. Thank you. Thanks very much.
Okay, that's everything in the chat box, and I think there's no other hands up. So a massive thank you, Melanie, and thank you all for attending. Hope you found this useful. And yeah, I'll be forwarding on the recording and your PowerPoint, Melanie, if that's okay to everybody.
Absolutely, to share it widely. It's it needs to be out there because there is a shortage, and we can do so much more.
Fantastic. Thank you very much, everybody. Hope you have a nice day.
Thank you, everybody, for your time. Bye-bye now.
Thank you. Thank you.
Thank you. Goodbye.